I grew up in Columbus, Georgia, and I'm the oldest of 4 kids, always been the big sister, kind of running the show. Was a competitive swimmer, did very, very well at that, kind of the smart girl. And 10 or 11, my incisors are growing in, and I had a lot of protrusion, and was, I guess, at that age where you're getting self-conscious about it, and my parents were, well, you're going to get braces. So braces, when I did get them, truly changed how I felt about myself and how then I could feel more confident and do the things that I wanted to do. So wearing braces for me as a patient and a kid, and that's what I try to continue to touch base with as now as a doctor treating these kids that walk in feeling the same way, and I know how they felt, and trying to make a difference in their smile. Whenever I went through high school, went to college at Emory, dental school over at Medical College in Augusta, and then got married, moved to Michigan, and finished my orthodontics at the University of Michigan. And my education is truly something I value. I always want our practice to encourage educating our patients. I think that's a lot of what I do here. It's not just straightening teeth, but teaching these adults and their children how to take care of their teeth for the rest of their life. I think that's a very, very important, and I think that the healthcare relationship we have with these children is very different than most of the time you go and 6 months later you go again for a cleaning and a checkup, and then it's out the door again. But we see our patients every 6 weeks for a year and a half to 2 years, and we become part of their life. And I want them to feel that we are their family, that we want their best interest, and not only in their smile, but to know what else is going on in their lives. And I think that that's a relationship that a lot of children have never had with a healthcare provider at all. I want them to trust us, and I feel like the parents are investing money and time, and they expect the best, and I'm going to give you the best that I can. And I think that's something that all of our staff is committed to, in giving you our best. My practice, after I finished the University of Michigan, my husband was still in his residency, and we were there. I was teaching in the department, and the faculty practice there did a lot of orthognathic cases, and the dental facial practice, and the craniofacial, the cleft clinic at the hospital. We had both of our sons there. Moved back here, hubby in residency, crazy hours. Running a practice just was not something I could manage at that point in my life. So I was working with a group practice here in Atlanta, and I think really kind of learning how I wanted my practice to run, and getting my feet on the ground. And then whenever he was offered a faculty position here at Emory, he always knew that when we knew where we were going to be, that I'd always wanted my own practice, and went to the bank and got a loan. And now I'm just so pleased that so many other women are going into dentistry and to orthodontics as a career. I was the first practice, a solo practice in Gwinnett County that had a female owner. And when we got back, and board certification was important to me, and I did that. I was the 3rd orthodontist in the state that was a woman to have achieved board certification. So again, that's kind of the step beyond wanting to make your qualifications and do that for your patients, because it wasn't required, but it was something that was important to me. And it was important to try to understand how I treat patients, to look at the final result so I can give them even a better result. But I've been here since 1997. The practice has grown. We had to expand. We've remodeled a couple of times, but I'm a one doctor, one location. I've been here. I raised my family in this community. I feel like this is where I live.